Well, Dr. Chris van Straten is a Global Health Advisor for Clinical Governance at International SOF. Dr. van Straten, good afternoon to you. We have 2 cases now. It's clearly moving in our community. How worried do we need to be about this disease?
Hi, good afternoon, and thanks so much for inviting me on the call. So in terms of worried, it's such an individual thing. We all worry about different things at different times. Personally, as someone who's been involved with diseases like COVID, in managing Ebola, plague in parts of Madagascar, I'm not hugely concerned, but that doesn't mean we can't just let our guard down. We need to know it's acting unusually. Monkeypox is not usually fatal. Most people recover just fine. There have been outbreaks, many outbreaks over the last 20 years in different locations, but this is definitely the biggest. So something has changed in terms of why it's transmitting and why somebody been infected, and we need to be cautious.
I can think of perhaps 2 things off the top of my head, and you're the doctor, I'm just a journalist, but the one would be coming out of COVID-19, maybe something has shifted. The second would be that older people, as I understand it, in South Africa, people over the age of 40, were vaccinated against smallpox, and monkeypox is related to that. But we stopped mandatory vaccination of smallpox some time ago. Could it mean that more people are now more vulnerable? Could that be the reason?
Very good question. It's an excellent question, and something you'll see some of the top virologists in our country and globally have asked the same question. And we think it might be playing into it. And you're absolutely right. Orthopox viruses, including smallpox, including monkeypox, they're brother and sister. But smallpox was very infectious and killed a very high percentage of those infected. And it's the only virus that we have eradicated from the planet. How? Fantastic vaccine, the smallpox vaccine. All the countries got together globally, vaccinated over 80% of their populations, including South Africa, and we wiped it off the planet. And yes, my mum still has some antibodies from her smallpox vaccine, and if she were to be exposed to monkeypox, she'd probably not get it, or have a severe case, or transmit to someone else. Excellent question.
So what do we need to do now? I mean, I presume that someone somewhere still is able to produce a smallpox vaccine. Do we need to break that out? Do we need to start that process again? Or do we just need to monitor this? Are we still at the sort of monitoring stage for a while?
Excellent question. So first off, there are still millions of doses of smallpox vaccines in mostly the G7 countries. So we're talking the USA, Canada, Germany, Australia, Singapore. Why they're there? They're kept in case of a resurgence of bioterrorism. That's been one of the fears of many countries for many years. There's also an effective monkeypox vaccine, specifically for monkeypox. And parts of the EU have bought hundreds of thousands of doses, and they are using it for at-risk people. So who's at risk? Doctors. Doctors who are treating patients, close contact, they are at risk of getting monkeypox. But like we saw with COVID, people who are immune suppressed, young children, pregnant women, they could get sick, more sick than most people from monkeypox. And for them, we'd like them to get vaccinated. And if there's no vaccine, there are antivirals, but again, not widely available. So my main message to people is we've survived COVID. Not all of us, but most of us have survived because masking, distancing, hand washing, and taking precautions, and then getting vaccinated if and when it's available. And yeah, so I think those are the primary steps to start with.
So, I mean, we got used to the idea of COVID-19. I don't know if we ever get used to the idea, but we got to know what the symptoms were. If we had a sniff, you went for a test. With monkeypox, it seems to be very different. I mean, we're talking about a certain kind of spot. Although it's a pretty identifiable spot. You kind of know it if you see it, right?
It is, however, and remember, I get this question a lot, and it's a great question. If you're traveling, let's say you're traveling in Africa, and you come back from your travels up north, and you come home and you got a fever, and you got a headache, and you got joint pains, The problem is, for us as doctors, the differential is really big. Because you could have COVID, you could have flu, but you could also have malaria. You could have dengue, you could have shigella, you could have typhoid, you could have cholera, or you could have monkeypox. Okay. So yes, in the beginning you get what we call a papule. It's a hard lump, it gets inflamed. That becomes a blister very similar to chickenpox. And then though, where it's different from chickenpox, it becomes pustular, filled with pus. Then it scabs over, then it falls off, then it heals up. And in the beginning, it can be difficult to distinguish. So we're saying, please, if you have been traveling, if you start with symptoms and signs, headache, fever, and you start with a rash, rather isolate yourself, contact a healthcare provider, get tested. And if it's COVID, or it's a flu, or it's something treatable and easily treatable, great. But if it is monkeypox, for one, we can isolate, make sure you don't spread. Two, observe, support, and most people recover just fine. Hope that helps, Steve.
So you say observe and support. In other words, you don't need any sort of special treatment for this. You need to just be watched. You need to just treat, how you feel, I suppose.
Exactly. It's going to be much the same as we treated, let's say, mild COVID, or how we treat chickenpox, which is analgesic, something for the pain of the lesion, especially when it bursts, something for the itching like calamine lotion, something to bring down a fever like paracetamol, and rest and lots of fluids. And most people like that will recover just fine.
Is it related to chickenpox as well? I mean, is all of these things related to each other?
No, that's a really good question, one I've had many times in the last 2 months. They're actually very different. Varicella is the virus that creates chickenpox. And varicella zoster is when it reactivates later in age as shingles. Whereas orthopox is a different family. They've got a different, if you look under an electron microscope, they've got a very distinct shape. And if you do their DNA, they build differently. The blisters in the beginning look the same, and that's why people, and the fact that it says pox, so chicken pox, monkey pox, but they're different. And we don't even want to call it monkeypox. The WHO is thinking about changing the name, because actually it seems that the host could be in rodents and small ground animals in the jungles in Central and West Africa. And maybe rodent pox would be an actually more accurate name. It's being debated. But good question, no. Different from chickenpox altogether.
Well, thank you very much indeed. I really do appreciate it. Dr. Chris van Straten from International SOS, a very clear explanation of what we need to do and how we need to deal with it. Well,